Hello, hello, and welcome. Today, we will be doing a cranial nerve exam. As you may have noticed, if you are not new, if you're familiar with my channel, my background has changed. The power of a sheet is really awesome, and hopefully it's a lot more easier to look at. It's easier on your eyes. It's easier. Look at all the rings. I went to Spencer's yesterday and I got rings. Look at them. Okay, this is very non-professional of me. And you may be wondering, why is a doctor wearing so many rings? And why does the doctor have her hair down? Which that is none of your concern. I'm a little unhygienic, but that's okay. We are going to start right out. Actually, give me this black one. We are going to start out with some light tests. We are just going to make sure that your eyes are working, they're up to date, testing out those pupils. So what I'm going to do is I'm going to have you look straight at me, look at my nose, and don't take your eyes off my nose. It could be anywhere. You could look at my forehead too. Just pick a spot on my face and stick with it. Look at it. Ready, and I'm going to go ahead and shine this light past your eyes. I'm going to kind of shine it in your eyes, so I'm just going to have you look straight at me, alright? Okay, I'm just gonna look. Okay. Alright, now I'm gonna have you go ahead and follow my finger. I'm gonna have you follow it. Follow it. Okay, now I'm gonna have you follow my finger and ignore the light. Follow my finger. Okay, good. Now I'm going to go ahead and have you follow the light, and the light only. Have you follow it. Follow the light. I'm just going to have you follow it gently. Really pay attention to the light. Do not take your eyes off of it. Okay, now I'm going to have you close your eyes. I'm just going to have you close them. Close your eyes real quick for me. Okay, good. Now that they're closed, I'm going to shine this light very close to your eyelids, and I want you to tell me how many times the light passes. I want you to tell me how many times you see the light go by your face with your eyes closed. Try to tell me if you can see this pass by. Good. Good. Okay. How many times did you see the light pass? Okay, good. You are right. Okay, so now I'm going to continue with more visual triggers just to kind of make sure your eyes are working properly, as everyone's should. I'm going to have you go back to following my finger, but I want you to continue to stare at it and ignore anything else that gets in the way. Are you paying attention? Look at my finger, look at it. Okay, now look at this one. Follow it. as it gets further back, I want you to continue following my finger further back. Okay, okay. Now I want you to tell me, how many fingers am I holding up? 2. Good. Okay, how many fingers am I holding up? Okay, now tell me, how many fingers am I holding up? 4. Good. Okay, one more time. How many fingers am I holding up? 5. Correct. You are correct. So, it seemed to me, based off what I've observed, your eyes seem pretty well. The only thing is, you blinked when I was shining that light in your face. Good. Yes, your eyes, which, it's okay. Everyone blinks at that part, so that was kind of a little joke right there. You can tell I'm a doctor, not a comedian. Okay, I'm just thinking, what should we do next? I think we should test your reflexes out. We have this reflex tester, so I'm going to go ahead and have you sit down. You're seated down, you're seated, right? Correct? Okay, good. Okay, so I'm just going to go ahead and hit your knee. I want you to relax your muscles, relax your legs. Just kind of sit very calmly and still. I'm just going to go ahead and just go a little. Okay. I'm going to do that one more time. Ready? Good. We're going to go ahead and do the other knee. Yes, your left knee made very good response. Everything was pretty great. We're going to go ahead and do this other knee. Okay, that was good. We're going to go ahead and do that one more time. Just go ahead and relax. I'm going to have to repeat that one. Your muscles are kind of like tensed up, which that's totally okay. Everyone does it. Happens. Just go ahead and relax your knee for me. I'm going to do this one more time. 3, 2, 1. Okay. Good. So you seem to have your reflexes working pretty good. So, okay, yes, your reflexes did perform very well. I'm going to go ahead and write that down real quick. Okay. And then what we will do next is I'm going to be checking your heartbeat, your heart rate. Just kind of making sure that everything is, functioning like it should. Just gonna go ahead and take this. Just gonna go ahead and listen, just sit still. And I want you to take a deep breath in and then a deep breath out, okay? Can you do that? Okay, good. Deep breath in and out. Okay. Deep breath in and then out. Okay. Deep breath in, out. I want you to try and take a big deep breath, as big as you can. I just want to kind of listen onto your lungs and listen to your breathing while I'm at it, just to make sure everything's all right. In, out. Good. I'm gonna have you turn around and then I'm gonna listen to your back. Yeah, okay, can you do that? Thank you. I'm just gonna go ahead. Take a deep breath in and out. Take a deep breath in and out. Okay. Take a deep breath in and out. Good. So things sounded alright. I did notice in your breathing there was some mucus, some phlegm, which is completely normal, especially at this time of the year. It's very common for people to have a little built up mucus, Winter can kind of like harden things inside, just really like clogs up your nasal passages, all of that. So it's completely normal, but I will suggest, maybe some humidifiers or start drinking tea. Tea has lots of like really healthy benefits. Jasmine tea is good. Eucalyptics and you know, kind of do whatever, you know. Rosemary, elderberry. Elderberry is very good for the lungs and getting that mucus out. So, yeah, I will ask, do you smoke or partake in anything that might have an influence on your lungs? Okay, okay. Yeah. Okay. Let me just write that down real quick. Okay. Alright, I'm gonna go ahead and take this right here. And this, I'm going to be testing your hearing with this. So what I'm going to do is I'm going to have you don't have to close your eyes or anything, just kind of, you know, sit still, try to be as quiet as possible, and really like focus on what you hear. And I will go ahead and hit this against the palm of my hand, and I want you to tell me if you can hear it. I'm going to do your left ear and then your right ear, and we'll go from there, okay? Alright. Did you hear that? Okay, okay. Could you hear that? Alright. Okay. And one more. Okay, good. So, you do have some just very, very slight problems with hearing. There's nothing bad. I might suggest getting your ears professionally cleaned. Lots of earwax buildup can actually stop you from hearing, and that is most likely what it is. So I would really suggest getting your ears cleaned out, doing it professionally. Q-tips are not advised. I do not recommend using Q-tips because they can shove earwax down your ear and clog it to make it so you can't hear even anything. It's just, I really don't recommend doing all of that. And as a doctor, please take my advice. It is worth the money. It improves your hearing and it just makes things a lot easier in the long run. Yes. Okay. And I'm going to go ahead and kind of check your muscles. So what I'm going to do is I'm going to go ahead and feel your face. Kind of feel around. And all you have to do is just listen to my instructions. I'm going to go ahead. I'm going to go ahead and feel your jaw up to your temple right up here. So I'm going to go like that. And I want you to open your jaw and then close your jaw, okay? Can you go ahead and open? Okay, okay. I'm going to kind of go down your jaw. Go ahead and open your mouth. Yeah, open it wide. Okay, and close. Go ahead and cut up here. Open. Close. Okay. I'm just going to have you just sit and do nothing. You don't have to do anything. Just kind of relax your face, relax yourself, and I'm just going to kind of like feel up here. What I'm doing is I'm just kind of feeling to see if I can find any tension in your muscles, any bone impurities, you know, kind of anything that I need to like look out for. It's always really good to kind of do this sort of thing just to make sure that there's nothing under your skin that could possibly build up to be worse. We know everyone gets pimples, so pimples are they're a thing, but cysts also exist, and it is kind of hard to differentiate the both. So I get a lot of people coming in thinking that it's just a pimple, when in reality it's a cyst, and it's been there for forever. And pimples do not last. They don't have the same lifelong living as cysts do. So it's always really good to check that out. Okay. get a feel for that. Alright, good. Yes, very good. Let's see. I'm gonna go ahead and feel down your neck just to kind of, like I said, just check, make sure everything's alright. So I'm just gonna go ahead. Alright. Okay. And I'm also checking your pulse really quick. I know I listen to your heartbeat, but it's always safe to double check. Okay. Alright, and then I'm gonna go ahead just really quick and check your ears, just to kind of like double check about that earwax going on, see how serious it really is. So I'm going to, just have you sit still. I want you to turn your head that way so I can check your ear. And alright, just kind of relax. Just gonna check in here. Okay. Check in here. Okay. So I am seeing quite a bit of wax going on, which, like I said, just go to a professional, get that checked out. You actually might be able to get it covered if you don't have the money to pay for it. If you have insurance will cover it. Process can be a little tricky at times, but it's worth it. Trust me, it is so worth it. I'm gonna have you go ahead and just turn your head the other way. Good. Kind of like look in here. Yes. Okay. I'm just gonna let go. Alrighty. Yeah. So your left ear has a little bit more wax than your right ear. So, I don't know. Also, you can get specific tools for ear cleaning online. I really suggest doing a lot of research around it. That is very, very, very good advice that you need to take if you are planning on doing something like that. But like I said, it's always great to get a medical professional rather than doing it yourself. But if worse comes to worse, you gotta do it yourself. There are simple ways to do it yourself. I can give you some papers on it if you want. Yeah, okay. I can get those papers printed for you in a minute. We are all done here. But basically just following up to what I said. Maybe get your ears cleaned. It's fine. Everyone should at least twice, a couple times in their life, Wax builds up. You gotta get them checked. It's always good to get a medical professional and get their advice, get their stance on it. So yes, get your ears checked and cleaned. Some tea, maybe kind of get that humidity, bring it back, try to breathe in your lungs, kind of clear that mucus out. If you plan on smoking or anything like that, vaping included, if you plan on doing any of that, you can buy elderberry drops. Those are very good for, kind of clearing that mucus out of your lungs for sure. I do suggest just to stay away from it, but, not a lot of people do, which is completely fine. It's just my job to give you medical advice around it, So yes, tea, but I really do advise drinking tea. It's just such a simple thing, some natural flavored tea. It's very helpful and it goes a long way. It's very helpful. But thank you so much. If you want to go ahead and walk down the hallway, I can get those papers printed out for you, and I'll bring them out. I just gotta, clean up some things and print those papers. Yeah. Alright, it was really nice having you come in today. Yes, it was really nice. Alright, I'll see you. Bye-bye.